Human physical capacity reaches its absolute peak around age 35. After that, the body enters a phase of progressive and measurable biological decay. When researchers tracked the Swedish population cohort for physical activity and fitness over 47 years, they documented this steady, downward trajectory. As people approach their 60s, their absolute aerobic capacity naturally drops at an accelerating rate. But then there is the master athlete. These are individuals who maintain intense, high-volume endurance training deep into their later decades. In clinical tests, these older athletes demonstrate an ability to preserve their VO2 max, the maximum amount of oxygen the body can use, at levels rivaling someone 20 years younger. However, these high performance levels can mask the underlying progressive erosion of cardiovascular function that occurs with age. It is a logical assumption to make. People who run marathons for their entire lives should have the healthiest, most protected hearts on Earth. Data from the Master at Heart study reveals a contradiction. Lifelong male endurance athletes harbor a higher prevalence of coronary plaque than healthy sedentary men. Critically, this plaque develops in the proximal segments, the main coronary entryways controlling blood flow to large territories of the heart. When these main arteries narrow, the resulting oxygen starvation can lead to a completed myocardial infarction. In the United States, over 170,000 of these heart attacks happen annually without the patient ever realizing it, a condition known as an unrecognized myocardial infarction. High fitness levels do not prevent coronary disease. Instead, they change the way the disease presents itself to the victim. Endurance sports require the heart to pump massive, hyperdynamic volumes of blood. During severe exertion, blood rushes through coronary arteries with intense speed and force. This constant, turbulent flow creates mechanical friction against the inner walls of the blood vessels, a phenomenon known as hemodynamic shear stress. This friction damages the vessel lining. When combined with conventional risk factors like LDL cholesterol, this mechanical stress acts as a catalyst, accelerating the buildup of plaque. The failure point occurs when the athlete pushes to their physical limit. The heart's immediate demand for oxygen exceeds the restricted supply able to squeeze past the plaque. The act of elite training creates the extreme mechanical forces necessary to trigger the heart starvation. When heart tissue starves and begins to die, it typically triggers crushing chest pain, yet these highly trained athletes often feel nothing. One reason for this silence is exercise-induced hypoalgesia. Intense training floods the brain with endogenous opioids and endocannabinoids. This chemical surge acts as a powerful internal painkiller, artificially raising the body's pain threshold so high that the brain ignores the heart's distress signals. Secondly, structural masking. The heart grows microscopic backup blood vessels, called collaterals, which reroute blood around blockages, delaying the onset of pain. The third factor is age-related autonomic neuropathy. As we age, the physical nerve fibers responsible for transmitting cardiac pain naturally dull, weakening the distress signal. Years of rigorous conditioning inadvertently biologically engineer the body to mute its own failure alarms. This creates what cardiologists call the masked athlete phenomenon, a state where high cardiovascular capability hides the internal reality of dying tissue. In the Katzel study, 16% of older male master athletes experienced silent ischemia while pushing their limits on a clinical treadmill test. Their hearts were starving for oxygen, yet they reported zero symptoms. A lack of pain does not mean the heart muscle survived intact. The starved tissue dies and turns into rigid fibrosis. This damage is often discovered later through an MRI. It presents as late gadolinium enhancement, or LGE, a glowing patch of literal scar tissue marking where a silent heart attack occurred. A silent heart attack is not a harmless event. It carries the same elevated risk of sudden cardiac death as a painful, recognized heart attack. Cardiovascular fitness does not allow you to outrun biological aging or the dangers of cholesterol buildup. For the highly active, a cardiac event does not always feel like crushing chest pain. The actual clinical red flags are subtle: unaccustomed shortness of breath, profound fatigue, or a sudden, unexplained drop in athletic performance. True longevity requires listening to those subtle drops in physical capability, because when it comes to the human heart, sometimes the fitter you are, the quieter the warning becomes.